Hey everyone, back again for another deep dive, and this time, we're going to be looking at heart health.
Great topic.
Yeah, looks like you guys gave us a ton of information on heart disease and really want to understand it better and prevent it.
It's a good idea.
Yeah,
Really important.
super important. So we've got this in-depth guide here all about it, and we're going to break it down for you.
Should be fun.
Yeah, so we're going to talk about the different types and causes and all that fun stuff, and then give you some tips to keep your heart healthy.
Yeah, one of the things that's really interesting is that heart disease, it's not just one thing.
Oh, really?
Yeah, it's actually a bunch of different conditions that can affect your heart and your blood vessels.
Huh, okay, so like a whole bunch of things to watch out for.
Yeah, and they can each impact your heart in different ways.
Okay, I see.
It's kind of like, the electrical system in your house.
Okay.
Like if one circuit gets overloaded or a wire gets frayed, it can mess up the whole flow of electricity in the
Wow.
whole house.
Yeah.
It's similar with heart conditions. They can each disrupt the flow of blood in your body.
Okay, cool. I like that analogy.
Mm-hmm.
So let's break down some of these different conditions then.
Sounds good.
I know coronary artery disease is a big one.
CAD.
Yeah.
Yeah, that's the one a lot of people think of as the classic heart disease,
Right?
And it starts with this buildup of plaque in the walls of your arteries.
Oh.
It's like cholesterol and fats and other stuff.
So they just get clogged up.
Yeah, exactly.
Okay.
Over time, it hardens and it narrows those arteries so the blood flow is restricted.
That doesn't sound good.
Not good at all. And especially when it happens in the coronary arteries, the ones that supply blood to the heart muscle itself.
Right.
That's when you can have problems.
Yeah, because then your heart's not getting what it needs.
Exactly. It reduces the oxygen-rich blood that gets to your heart, and it can cause chest pain,
Oh, no.
especially when you're active,
Oh, wow.
which is called angina.
Angina, yeah. So is
Uh-huh.
that how heart attacks happen then?
Sometimes, yeah, you see if a piece of that plaque breaks off, it can form a blood clot. And if that clot blocks the whole artery, then the blood supply gets cut off to a part of the heart.
Oh, geez.
And that's a heart attack.
So it really is like a plumbing problem.
It is a plumbing emergency.
Yeah, so chest pain.
Yeah.
Big warning sign, I guess.
It is. It's one of the most common symptoms.
Okay.
But the thing is that CAD can show up in different ways.
Really?
Yeah, like some people have that, classic crushing chest pain.
Right.
But others might have different things going on, like shortness of breath, nausea, or pain in their back or jaw.
Huh. So it could be a lot of different things.
It can, and this is especially true for women. They tend to have less typical symptoms.
Oh, wow. So you really can't just ignore anything unusual.
Especially if you have other risk factors like high blood pressure or high cholesterol.
Yeah.
But, one of the biggest culprits is smoking.
Oh, right. Yeah, smoking's bad for you in like every way.
Pretty much. And for your heart specifically, it's really bad because it damages the lining of your blood vessels.
Well.
So they're more likely to clot.
Oh, I see.
Plus, it raises your blood pressure and heart rate, and that puts a lot of strain on your heart.
Okay, so like a triple whammy.
Exactly. It's
Right.
really doing a number on your heart.
Yeah, big motivator to quit, that's for sure.
For sure.
So we talked about coronary artery disease,
Yeah.
but there are other types of heart disease too, right? Not just blockages.
Yeah, there are.
This guide mentions a few others.
Yeah, so like sometimes the problem isn't a blockage, it's the heart muscle itself. Like with heart failure.
Okay.
That's one example.
Now, I've heard of heart failure, but I'm not really sure what it means. Does it mean your heart just stops?
Not necessarily. It just means it can't pump blood as well as it should.
Okay.
It's like a pump that's getting worn out.
Okay.
It's still working, but it can't keep up.
Right.
And that can lead to fluid buildup and shortness of breath and fatigue.
So it's more like it's weakening.
Yeah, exactly. It's struggling to do its job.
Gotcha. So there are different types of heart failure too then.
Yeah, there are, depending on which part of the heart is affected and how.
Right.
Sometimes it's a gradual weakening, and sometimes it's a sudden decline in the heart's ability to pump.
Okay. Wow. It sounds like heart health is more complex than I realized.
It can be. Yeah, and there are a few other conditions too.
Right. This guide mentions a few more I'd love to talk about with you.
Yeah, let's dive into those.
Okay, cool. So we've covered coronary artery disease and heart failure, but there's this other thing in the guide, arrhythmias.
Oh, yeah.
What are those exactly?
Arrhythmias, those are basically irregular heart rhythms.
Okay.
So instead of like a steady beat,
Right.
your heart might be too fast or too slow or like all over the place.
So like it's offbeat.
Exactly, yeah. And some of them are harmless, but some can be serious.
Oh, okay.
Because they can mess up how well your heart pumps blood.
Right.
And there are actually a lot of different kinds, each with its own, quirks and problems.
So like a whole category of its own.
Yeah. It is.
This guide mentions atrial fibrillation. Is that one of the serious ones?
Atrial fibrillation or AFib, that's
Hmm.
one of the most common ones.
Yeah.
And that one affects the upper chambers of your heart, the atria,
Right.
and it makes them quiver instead of contracting smoothly.
Oh, wow.
So the blood can pool up in the atria, and that increases the risk of stroke.
Oh, so it's not just the heart itself. It can cause problems in other parts of your body.
Yeah, exactly.
That's scary.
Yeah. And then there's ventricular tachycardia,
Okay.
which is a really rapid heartbeat that starts in the ventricles, the lower chambers.
Okay.
And that one can be super dangerous
Oh, gosh.
because it messes up your heart's ability to pump blood.
Okay.
And that can be life-threatening.
So arrhythmias are definitely something to take seriously.
Definitely.
Are they caused by the same things as like coronary artery disease and heart failure?
Well, there's some overlap, for sure. Like high blood pressure, smoke, and diabetes, those increase your risk for both CAD and arrhythmias.
Right.
But other things can cause arrhythmias, too.
Oh, really? Like what?
Like electrolyte imbalances or some medications.
Okay.
And even underlying heart conditions like congenital heart defects.
Right. This guide mentions those two congenital heart defects.
Yeah, those are problems with the heart's structure that you're born with.
So like the heart didn't form right.
Exactly. They
Yeah.
can be mild or severe and affect different parts of the heart,
Wow.
like the walls or valves or blood vessels.
So like it's a problem from the very beginning.
Yeah, and we don't always know exactly what causes them,
Right.
but genes and stuff that happens during pregnancy can play a role.
Okay.
But the good news is a lot of them can be treated
Okay.
with surgery or medication, especially if they're caught early.
So early detection is key.
Yeah, it really is for
Oh, wow.
so many things.
Makes sense.
Like, we talked about treatment a bit, but what are some of the ways that heart disease is actually treated?
Yeah, that's a good question.
It really depends on the type and how bad it is.
Okay.
Sometimes changing your lifestyle is enough,
Okay.
but other times you might need medication or even procedures.
Right.
So it really varies.
So what kind of lifestyle changes are we talking about?
Well, the big ones are diet,
Okay.
exercise,
Yeah.
and managing stress.
Okay. Those are all important.
Yeah, and eating a heart-healthy diet can really make a difference, Lots of fruits, vegetables, whole grains, lean proteins.
So it's not just cutting out the bad stuff, it's adding in the good stuff.
Exactly.
Yeah.
And regular physical activity is also super important.
Holding your heart rate up.
Yeah, it strengthens your heart muscle and improves blood flow, and it helps manage weight and stress.
There's so many benefits.
Yeah, a lot of good stuff.
And of course, there's quitting smoking.
Oh, yeah. Can't forget about that one. That's one of the biggest things you can do for your heart.
It's so hard, though.
It is, but it's worth it. The benefits are huge.
So you said medication sometimes, too.
Yeah, medication can help manage different parts of heart health.
Okay.
Like there are medications to lower blood pressure and cholesterol, regulate your heart rhythm, prevent blood clots, and even help your heart pump better.
Wow, so many different kinds.
Yeah, they're like tools in a toolbox. Each one's for a specific job.
Oh, okay.
And then sometimes you might need surgery,
right.
like coronary artery bypass surgery to reroute blood flow around blockages,
Okay.
or valve replacement surgery to fix faulty heart valves.
It's amazing what they can do now.
It really is. And there are always new things coming out, offering hope for people with heart problems.
That's good to hear.
Yeah, it is. So we talked about past causes treatments, but what about preventing these things in the first place?
Right. Prevention is key.
Exactly. And that's where those lifestyle changes come in again.
Right.
They're not just for managing heart disease. They're important for preventing it, too.
So it all goes back to healthy habits.
Yeah, diet, exercise, stress management, and not smoking.
The big...
Exactly. It's about building a lifestyle that supports your heart, not one that puts it at risk.
And it's never too late to start.
Never too late or too early.
Right. You can always make changes.
Exactly.
This is great. I'm learning so much.
Good. I'm glad. And one more thing. Knowing your family history is important.
Oh, right. Genetics.
Yeah, if you have a family history of heart disease, you got to be aware of that and talk to your doctor about it.
So being proactive.
Exactly. And don't be afraid to ask questions. The more you know about your heart health, the better.
That's a great point. Knowledge is power.
Absolutely.
Well, this has been super insightful. Thanks for breaking it all down for me.
No problem. I'm glad we could do this deep dive.
Yeah, me too.
Yeah.
Anything else before we wrap up?
Yeah.
Yeah, I feel like we've really gone deep on this topic, like covered all the bases.
Yeah, for sure. We've talked about the different types of heart disease, the causes, the symptoms, the treatments.
Even how to prevent it.
Yep, pretty comprehensive.
I think for me, the biggest takeaway is how much we can actually control our heart health.
Right.
It's not just all about genetics. Our choices make a huge difference.
Yeah, absolutely. I mean, we can't change our genes, but we
Wow.
can definitely influence how they express themselves.
Yeah.
If you have healthy habits, you can really lower your risk, even if heart disease runs in your family.
That makes me feel a lot better, actually, like I have some control.
Yeah, you do.
It's not about being perfect. It's just about making good choices.
Exactly. And it doesn't have to be overwhelming either.
Okay.
Just start with small changes,
Okay.
swap out sugary drinks for water, take the stairs instead of the elevator,
Okay.
find an activity you enjoy and do it a few times a week.
Yeah, like little things you can stick with.
Exactly. Consistency is key.
Right.
Even small choices, when you do them regularly, they can really add up over time.
So it's not about making drastic changes overnight.
No, it's about those everyday choices that build a healthy lifestyle.
Exactly.
And one last thing I want to say is don't wait until you have symptoms to start thinking about your heart. Prevention is always better than a cure.
So true.
So be proactive, stay informed, and take care of your heart now.
That's a great way to end this. I think your heart is definitely worth it.
For sure.
Thanks so much for taking us on this deep dive. I feel like I learned so much.
Of course. Happy to do it.
Yeah, and to all of you listening, thanks for joining us on this journey into heart health.
It's fascinating stuff.
It is. And remember, even small steps can make a big difference. So take care of your hearts, and we'll catch you on the next deep dive.